today we are going to talk about opportunities beyond 1,000 days. And our guest for today is Professor Benjamin Crookston. He's a professor of public health nutrition at Brigham Young University in Utah, United States. And also we have Dr. Kirk Dearden, who's been working with Imawut Health in Tanzania in a project to prevent stunting in 5 regions in Tanzania. Thank you very much, Ben and Kirk.
Welcome.
And my first question is related to the study published in American Journal of Clinical Nutrition. It is authored by Ben and also by Kirk, which talk about post-infancy growth, schooling, and cognitive achievement. So can you tell us more about the design, the subjects, and the main findings of the study, Ben?
Yes. So Dr. Dearden, myself, and a number of other colleagues from various countries around the world worked on this study, in collaboration with a study out of Oxford, England, Oxford University, called the Young Lives Study. And the Young Lives Study follows 8,000 children in 4 different countries: Ethiopia, Peru, Vietnam, and India, and follows these children from when they're 1 year of age and forward several years. And in our study specifically, we looked at measurements of growth and cognition at years 1, 5, and 8. And the primary purpose of our study was to determine how kids who experience growth recovery following early nutritional insults and deficits, how well they did cognitively when they were age 8 compared to kids who experience persistent stunting or with children who never experienced any nutritional deficiencies. And what we found in our study, the results showed that children who experienced some form of growth recovery did better in the 3 different tests that we looked at: mathematics, receptive vocabulary, and reading comprehension. They're also more likely to start school on time than their peers who experienced stunting and who didn't recover.
That's very interesting. And Kirk, can you tell us the relevance of the study findings with Tanzania context or perhaps Indonesia?
Yes, so as somebody who's trained in epidemiology, I almost always a little reluctant to say it's directly relevant to Tanzania. But because one of our countries was Ethiopia, and because we looked at 4 countries across 3 continents, I think there is relevance to Tanzania.
And for Indonesian context?
I think as well. Yeah, I think the closest country to Indonesia was Vietnam in the study. So, like I say, we need to be careful in our interpretation, but because there are multiple studies, even beyond ours, that are showing this, I think we do need to look at the results and consider how they might be applied in Indonesia or Tanzania.
And these 8,000 children represented quite a range of different household wealth, quintiles, ethnicities, and so there was really, rural and urban mix, and so there's really quite, as Kirk says, you can't generalize results to every other place, but we think these are pretty informative for countries even that weren't included in the study.
All right. So what do you think of the first 1,000 days, which is widely believed as the most, or maybe for some, the only important period of child development?
So I would agree with those who believe that it's the most important period of development. Research, study after study, has shown that window of opportunity from conception till the 2nd birthday includes very rapid brain development as well as the rest of the body, and that the nutrients that a child receives during that time are very critical for the long-run experience and productivity of that person in a population. And that investments made during that time are really, really valuable and important.
Good.
I agree. Yeah, I think that it's a change in mindset for policymakers and program planners, implementers, evaluators, because we tend to get fixated on the first 1,000 days of life. But in fact, there's quite a bit of potential for catch-up growth and improvements in cognition and performance in school. So we should not ignore beyond 1,000 days, because many children actually do recover from stunting.
Okay, so what are the opportunities beyond 1,000 days?
So our study showed that children beyond that 1,000 days can recover. And so while we didn't measure specific interventions to look at what would make a difference, we do know from other studies that maternal education plays a role, the wealth of the family, whether or not they live in an area that has various services. So children who lived in urban areas were more likely to recover. So what we, as Kirk mentioned, children beyond that 1,000 days can still experience meaningful recovery and improvements, and those translate into other cognitive benefits as well.
What can we do to improve the growth and development? So, for example, if the child was stunted in the first 2 years of life?
I think we can change the dialogue and what we're thinking about in nutrition. So obviously it's beyond the first 1,000 days of life we need to focus, and that means initiating a discussion with policymakers and government, donors, multilateral organizations. There is some pushback at times on this concept, but I think we have some compelling evidence that that we can make a difference. And one of the best venues, I think, is working with departments of education, ministries of education, because they do recognize the importance both of nutrition and of child development across a long period of time.
So that would impact, of course, national nutrition policy and programs. So, for example, in Indonesia, we have 1,000 days movement. Do you think it needs to be expanded?
Absolutely. Yeah, absolutely. I think we can have a much greater impact on children if we expand it beyond 1,000 days. So looking at pre-primary school as well as primary school, because subsequent studies we've done suggest that catch-up growth continues even beyond 5 years of age.
And what do you think, Ben?
Yeah, I agree with Kirk. I think that we need to maintain a strong focus on the first 1,000 days, but an openness to working with children beyond that and investing in programs that would continue to benefit children and their households.
Great. Thank you very much.
Thank you.
Thank
Ben.
you, Dr.